Non-pharmacological modalities for intractable epilepsy means what are the non-anti-epileptic medication options to treat intractable epilepsy patients. We have to think out of the box in terms of management when we treat intractable epilepsy patients. Those are the patients who represent almost 1/3 of our epilepsy patients are labeled as intractable, which means patients who have seizures despite 2 or more adequate trials with properly chosen anti-epileptic medications. Those patients, unfortunately, may continue to have seizures despite trials of 3 medications, 4 medications, 5th medication, and so on and so forth. That's why in this instant, we have to think out of the box and ask ourselves, are there any other options other than medications? We know that medications are effective, but on the other hand, they might have side effects, drug-to-drug interactions, abnormal electrolyte functions, allergy, and others. So one of the other options we think about it, especially in neonatal forms of epilepsy or in metabolic forms of epilepsy, are vitamins and cofactors. And common examples of those conditions are pyridoxine-dependent epilepsy, pyridoxal phosphate, folinic acid, as well as betaine-dependent types of epilepsy. Those babies might have intractable seizures and fail multiple medications, and once we try a cofactor or vitamin, they might show a dramatic improvement. One of the other options is the inflammatory mediators. Options like steroids and IVIG are important to consider in intractable epilepsy. A common example is an intractable epilepsy patient in the context of possibly inflammatory condition, and a trial of steroid like in Rasmussen's encephalitis, for example, or in Lennox-Gastaut patients can result in dramatic improvement. Another example is infantile spasms, in which steroids is one of the approved medications to treat their condition. Another option is IVIG, either in 1 day up to 5 days course, also might result in improvement in some intractable epilepsy patients. If we think also of other options, we can think of herbals as an example, and the commonest example is the FDA-approved cannabinoid or marijuana extract, which can be used in 5 to 20 milligram per kg per day dosage to treat conditions like Dravet syndrome. Other options to consider are diet options, and the famous example is the ketogenic diet, which is simply a diet that has a high fat content and reasonably protein content and a small amount of carbs. Scientifically, those patients, when they commence on the ketogenic diet, their body will shift the use of glucose into ketones, and ketones passes the blood-brain barrier into the brain and can result in improvement. Studies say that 30 to 50% of patients tried on ketogenic diet might have significant improvement of their seizures. Another option to treat intractable epilepsy patients with options other than anti-epileptic medications is epilepsy surgery, which can range from 1-day procedures like the famous example of vagal nerve stimulation or VNS, and going through invasive procedures like corpus callosotomy, which is indicated in Lennox-Gastaut patients with intractable atonic and tonic seizures, and it can result in dramatic improvement up to 70% seizure freedom in those patients. Another more invasive options are the surgical options like lesionectomy, lobectomy, and hemispherectomies in cases that has unilateral disease like unilateral stroke, unilateral abnormality in the gray matters, and unilateral brain atrophy.